Okay, thank you. Another question. Being from Northampton County along the Delaware, one of the problems my district office gets a lot is the black fly program. Can you give us a status on that program?
Sure. Once again, this year we're basically flat funded. It's $3.3 million. The reality is that allows us to basically work April to May and then July to August with spraying. Back when the program was more flush, we used to do year-round or throughout the season spraying to keep the black fly populations down. I know we see complaints during those times when we're not out there spraying. The additional piece I'd always remiss if I don't point out is because in the Delaware in particular, the nature of the spraying is New Jersey ends up getting a benefit from that. We don't receive any funding or support from that from New Jersey, but it's just the way the water flows that leads to that situation.
Okay. I think the other program, the West Nile virus and Zika virus control, is also pretty much level funded. So do you have can you give us a status on that? And also, do you think there's any problems there with protecting the public health if we don't increase that?
Sure. And in fact, first I'd say thank you for recognizing and increasing that. Last year, we received a bump up, in particular to deal with the Zika virus within that. I think in terms of managing what we need to manage within both sides of the mosquito program, we have had what we needed to manage that effectively. Our responsibility on that is really a surveillance program that we are sending out traps, collecting the mosquitoes, identifying type of mosquito, whether it has West Nile or not, whether it's a type of mosquito that could carry the Zika virus, and then based on that, working with Department of Health on what the appropriate outcomes are. And then we also have a mitigation plan where if we're identifying issues, we're out making sure we're removing old tires, things that may collect water, educating people, et cetera.
Going back to black fly, is there if you see an increase, is there any way to get more funding into that?
The money and the money that we have for that is pretty set, and the contracts are pretty set. So we don't have any additional dollars within the agency that can be brought to bear on that issue.
Thank you. Thank you, Mr. Chairman.